Hello, everyone. Welcome to the Retiree Benefits webinar. This presentation will help you understand your benefits offered to you as a University of Rochester retiree. Today's topics we'll be going over in the presentation today. If you do have any follow-up questions, please let us know after the presentation, or you can contact the Total Rewards office for more assistance, or we'll give you our direct email to follow up with us after the presentation. Today we'll be going over the retiree benefits eligibility, service credit for outside of U of R, as well as previous service at the University of Rochester, Medicare eligibility and a timeline for enrollment, our health and dental benefits offered to U of R retirees, a few other retiree benefits, and then timeline and takeaway. So for the new eligibility to be a U of R retiree, you must have 15 years of benefits eligible service. Benefits eligible service is full-time or part-time, not per diem or time as reported. You need to work 5 consecutive benefits eligible years leading up to retirement, and you need to be age 60 or older and meet all of these requirements. This is if you were hired after 1996, but if you were hired or rehired before January 1st of 1996, your retirement age is 55. So as of January 1st of 2021, there was a change from 10 years of service to 15 total years of service. Now retirees will be able to receive full contribution subsidy for a 15-year service, prorated contributions based on years of service. The last bullet, employees can now retire at a part-time status and receive a full-time contribution if they work enough full-time service. This is the new change to our retiree benefits. And what that means is you do no longer have to retire first at a full-time status, then return to work part-time. What you can do now is just drop down to a part-time status, and then you will be able to look at your entire career here at the University of Rochester and see if you have met either full-time or part-time status. There is a transition period of the old benefits. So from January 1st of 2021 to December 31st of 2023, the old requirements will be in place. And the old requirements were 10 years of service if you were hired or rehired after 1996 with an age of 60. So in this time frame, if you meet the old eligibility, you can retire from the University of Rochester and receive benefits. And if you do have any questions about your service time here at U of R, please contact the Total Rewards office and let us know, and we'll be able to see where you stand. Now, service credit. So if you have worked at another higher education institute, or if you have previously worked at the University of Rochester in a benefits eligible position, please let us know and we will send you a form to fill out. Now, what this service credit can do is it can bump you up to retiree eligibility. So as an example, let's say that it is 2024 and you have worked 10 total years here at University of Rochester. Now we're in 2024, so you need to have 15 years of service. And let's say that you have worked previously at RIT for 10 years. You can fill this service credit form out. Let us know if that service time was part-time or full-time from RIT, and then we can add that onto your total years of service here at U of R, making you retiree eligible because you will have over 15 years of full-time or part-time benefits eligible service. So it can be from another higher education institute or the University of Rochester. No teaching hospitals or sister schools service time is authorized at this time. So now what we'll do is talk about Medicare eligibility. So again, this is for the general population because the average retiree is around age 65. This also includes you and your spouse. So who is eligible for Medicare? So individuals age 65 or older who paid Medicare taxes for at least 10 years. Individuals under age 65 with certain disabilities. Now this is authorized by Social Security. So if you fall under this category, you will know. and individuals of all ages who suffer from end-stage renal disease. So first, there's something called an IEP. It stands for Initial Enrollment Period. So this occurs when you are retiring at age 65 or already retired and you are turning age 65. Your initial enrollment period lasts 3 months before the month you reach age 65, the month you do reach age 65, and 3 months after, totaling 7 total months of your initial enrollment period. In order to be effective the month you reach age 65, you must apply 3 months prior to your 65th birth month through SSA.gov, or forms will be sent to you by Social Security in the mail. Now, even if you are born halfway through a month, your eligibility will always start the first of the month in which you reach age 65. Unless you are born on the first of a month, then it goes back 1 month previously. So if you are born on April 1st, your eligibility is actually March 1st. Now, there's something called a special enrollment period. This occurs when you are working past age 65 or you are past your initial enrollment period. Now, what you need to do is contact the Total Rewards office 3 months prior to your retirement date, and we will go over the forms and the process for your special enrollment period. So if you sign up for Medicare Part A, but not Medicare Part B, that's perfectly fine. This is a timeline of which you need to sign up for Medicare Part B if you are enrolling in your initial enrollment period. So if you just sign up 1 to 3 months prior before you turn age 65, your Medicare Part B will start as the month you reach age 65. So this is for anyone who is retired previously from age 65. This is when you want to follow. If you apply the month you do reach age 65, it becomes effective 1 month after. If you apply 1 month after, it's 2 months for an effective date. And if it's 2 to 3 months after your birth month, then it's 3 months. So this is very important, especially if you are planning to retire within a few months around your 65th birthday. You need to make sure that your timeline is correct. But if you do have any questions, you can always reach out to the Total Rewards office and we will help you on when you should enroll in Medicare Part B. When is Medicare enrollment for Medicare Parts A and B necessary? Now, if you have already retired from U of R and are no longer working in any capacity, and you are nearing age 65, you are in your initial enrollment period. This is when it's necessary for you. If you are working past age 65 and you decide to retire later, that is your special enrollment period. That is when you need to reach out to us 3 months prior. Now, it is not necessary to sign up for Medicare A and B if you are turning age 65 and you're continuing to work in a benefits eligible position here at U of R, either full-time or part-time. So if you decide to work until age 70 and you're 64 right now, when you turn 65, you do not need to enroll in Medicare A and B at this time, especially if you have the high deductible plan at the University of Rochester and you are contributing pre-tax dollars to your health savings account. You do not want to enroll in any parts of Medicare because Social Security and the IRS do not like you essentially double dipping, where you are taking pre-tax dollars from your paycheck, putting them into your HSA account, as well as receiving government aid by enrolling in Medicare. If you do take Social Security benefits, this will automatically enroll you in Medicare Part A. So if you are still planning on working and taking Social Security benefits, you need to decide if you want to take the Social Security or put money into your HSA. You cannot do both. If you do want to stop contributing money into your HSA, you can fill out a form on our Total Rewards website and it will stop.
So now we will discuss the benefits that are offered in retirement. Going into the Medicare health plan options, once you retire, if you are over age 65, coverage will change to a special form that supplements or coordinates with Medicare. You will have the option to utilize the new university-sponsored Medicare Marketplace through VIA Benefits. VIA Benefits offers a greater number of personalized health plans from multiple insurance companies. This comes with several advantages, including expert advice from licensed Medicare specialists year-round, a health reimbursement arrangement fund for premium reimbursement, and more individualized coverage overall. Now, diving deeper into the health reimbursement arrangement, which is referred to as an HRA. An HRA is a tax-favored arrangement used to reimburse eligible plan premium expenses up to an annual maximum. Eligible expenses include medical, prescription drug, and dental plan premiums. Please note, this does not include Medicare Part B premiums. If unused, the remaining HRA balance will be carried forward to the following plan year. One item to note here is that if you have an active paid TAR position at the university while enrolled through VIA Benefits, your HRA subsidy will be on pause until the TAR position has ended. IRS regulations prohibit the use of HRA funds from retiree-only plans while being actively employed. Moving on to the actual process behind the HRA and how that works. First, you will pay the premium to the health insurance carrier that you selected through VIA Benefits. Then you may either have automatic reimbursement set up if your plan has that option, or it may require reimbursement form with supporting documentation to be completed and then submitted to VIA Benefits. After that, you will then be reimbursed through VIA Benefits, either by direct deposit or mail check, whichever you prefer. You may select that method with VIA Benefits. So going into just a little example here, first, if you select a Medicare Advantage plan, let's say through the carrier Excellus, you'll pay your premium to Excellus, who is the insurance provider. You will then either have automatic reimbursement set up, or you'll have to submit a reimbursement form to VIA Benefits, and then you'll get reimbursed either through direct deposit or mail check from VIA Benefits. So here is an overview of the subsidy reference. All of these amounts listed here are in annual terms. You will see the single versus family coverage and surviving spouse benefits for the different levels of retirees. These are the amounts that can be used towards plan premiums as a U of R retiree. Please note, contributions will be reduced to half for those that are retired with the part-time eligibility. If one spouse is Medicare eligible and one spouse is non-Medicare eligible, please email us for more details on how that process works. Now on to the non-Medicare eligible plan options. If you retire and are not yet 65, you have the option to continue health coverage on the same plans offered under the active benefits, either the PPO plan or the HSA eligible plan. The rates of these plans will change from your current active premiums. These rates will be billed and payable to the University of Rochester on a quarterly basis. Please note, for the non-Medicare eligible plans, the subsidy will be in the form of a premium reduction. It is not in the form of an HRA. You will see on the right-hand side of the screen the 2021 non-Medicare plan rates. As stated earlier, these will be billed on a quarterly basis. However, the amounts listed on the screen are on the monthly rates. How it works is that the subsidy will be applied to the rate shown here, and the difference will be billed to you. Please note, these rates are subject to change each year during the annual open enrollment period. These rates are also located on the website, along with the subsidy reference chart that was included in the previous slide. In regards to the dental plans, retirees, both Medicare and non-Medicare eligible, remain eligible for the university's dental plan options. This includes the traditional or medallion plans, and whether you would like single or family coverage. This benefit is billed and payable to Lifetime Benefit Solutions on a quarterly basis. Cost does vary based on retiree level, and the rates are listed on our website as well. So once you have retired, you will still have access to some of the facilities here at the University of Rochester. You may obtain a retiree ID card in order to access the facilities. These include university libraries, university health services, employee pharmacy, athletic facilities, and Meliora dining. Now we will discuss your life insurance benefits and how they are affected once you retire. While employed in a part-time or full-time position at the university, you are covered by the University Basic Paid Life Insurance Policy. That coverage terminates at the time of retirement. You may be eligible for certain coverage to continue depending on your retiree level. For the employee paid optional life insurance coverage, you may elect to continue this coverage if you wish to do so, and you would pay the premium directly to Securian. You will be charged the same rate as the active coverage. However, it can increase based on your age bracket or change along with the university group rates. You may change your beneficiary for your life insurance at any point in time. You may log in through HRMS and click on Securian Life on the homepage, or you may go directly to lifebenefits.com and log in with the user ID and password. Your username is UR plus your employee ID number, and your password would be your 8-digit date of birth plus the last 4 of your social security number. Retirement can be a great time to go back to school. So once you retire, you remain eligible for tuition benefits for courses at the U of R as a non-job related benefit. Full-time faculty and staff are eligible for 70% tuition waiver for 2 courses per semester or quarter. Part-time staff are eligible for 70% of 1 course per semester or quarter. Dependent children remain eligible for tuition benefits when you retire as well. As a retiree, you remain eligible for your benefits extras as well. These benefits include group auto and home insurance, MetLife legal plans, and VSP vision care. You may go to yourbenefitsextras.com and click on the options for retirees. So now as a recap, here are some important items for you to note. If you are considering reducing time to time as reported, also known as TAR, it is recommended to retire before transitioning into a TAR position. If you are planning to return to work as TAR, you will want to contact our office for benefit eligibility information. If you do have an active paid TAR position at the university while enrolled through VIA Benefits, your HRA will be on pause until the TAR position has ended. This is due to the IRS regulations. If you retired with no return to work and then turn 65 later on, you will need to sign up for Medicare on your own through your initial enrollment period. Employees should schedule a meeting with our office no earlier than 3 months prior to retirement for those 65 and older. Employees retiring under 65 or those planning to return to work should plan to meet with our office 1 to 2 months prior. And for a general timeline, employees should contact retiree benefits 3 months prior to retiring, then meet with a representative, and if necessary, then enroll in Medicare Parts A and B. Then plan options can be reviewed and complete enrollment for that. After that, you will turn in your qualifying event change form that is provided in our meeting 3 to 4 weeks prior to retirement. You'll send that to us. And then you get to start your journey and remember to remain connected to U of R. For some final recommendations, please visit our website for more guidance and information. Also, make sure you take a look at our checklist on the website. You will also want to set aside time to do your research at home. For any additional questions, please email retireebenefits@ur.edu. www.retiree.rochester.edu. Again, here is our contact information below, and this is also listed on our website. Please do not hesitate to contact us with any questions. Thank you.